children, today let's start with chapter number 16, health facilities and our government. So in this chapter I will tell you about the healthcare in India, right? So in a democracy, the function of the government is look after the welfare of the people. This could be through provision of health, education, employment, housing, development of roads, providing clean drinking water, electricity. These are some facilities, and health means the ability of the people to remain free of illness, disease and injuries. The word health conveys a more positive concept and mere the absence of disease. So we are healthy if we are active and in good spirit, whatever we do it. It is not healthy to be dull, inactive, and anxious, or scared, or for long stresses and more. So we all need without a mental stress, all the aspects are the part of health. जितने भी ये aspects है सब क्या है आपकी health के part है. So we can say on other hand, if the people do not get adequate food or starve, it will lead to illness. So those who are poor in the first place to be undernourished, and these families do not eat much as they should. They provide the basic necessities like clean surrounding, balanced diet, clean drinking water, adequate housing, and therefore they are more likely to fall ill, right? And the expensive on illness make their situation even worse, and the women generally are not taken to a doctor in a prompt manner. Many rural areas have few health centers and they do not run properly. ये properly run नहीं करते हैं. Healthcare is based on health education. Like health education is a part of education but not in all aspects, and that is why people are not aware about the concept of balanced diet, good body hygiene. Now healthcare in India. In India, it is often said that government is unable to provide health service for all because it does not have enough money and facilities. So we can say that center, hospital, blood banks, laboratory, testing, ambulance. India has the largest number of medical colleges and large number of doctors, clinics and hospitals, and 15,000 of new doctors qualify every year. And in 1950 there are only 2717 hospitals, and in 1991 there was 11,174. And what happened in 2000? The number grew by 18,280. धीरे धीरे वो क्या करे, grew करे. And many countries people come from treatment in some hospital in India. They are compared with the best known world, with the cheaper, and India is the 4th largest producer of medicines. So about 5 lakh people die from tuberculosis every year. This number is almost unchanged in independence. Almost 2 million cases of malaria are reported every year. This number not decreasing. The reason behind the situation is that in the first case, most of the doctors, they settled in urban areas to earn and prosper. So they do not like to go to the village for the lack of facilities like clean drinking water, regular supply of electricity, clean environment. The rural people cannot pay more to the doctor. The medicines are too expensive, and all these medicines could not be sold like this. So what we do? Because they do not deal with the large number of poor patients seeking free service and free medicine. Now public health. The state government is responsible for planning and carrying out monitoring schemes to improve public health. It gets financial and technical help from the central government. By financial help भी लेता है और technical help भी लेता है. The state government runs hospital and health centers in urban and rural area of the state to provide medical treatment to the public at reasonable cost. ये medical treatment देते हैं public को at reasonable cost, and these are run mostly out of taxes paid by the public. And the state government arranges for sanitation, right? And it also organizes different kinds of health camps in the state to vaccinate people against disease. ये conduct करते हैं free medical tests, and they are responsible for giving health information to people, especially in the local language. It employs health workers to work among and tell the people how disease can be prevented and treated. The state government set up and runs a various institutions to train pharmacists, nurses and other types of health workers. And the health services provided by the state government reach us to with the chain centers. At the village level, there is usually a small health center where minor illness can be treated, and the village health centers is under supervision of PSCs, means primary health centers. So PSC का क्या काम होता है? ये supervise करता है health centers of several villages. ये qualified doctor होते हैं. What are these? These are qualified doctors. दे रेफर सीरियस इल पेशेंट टू बिगर हेल्थ सेंटर्स, जैसे डिस्ट्रिक्ट हॉस्पिटल हो गया, जहाँ पे आपको टेस्टिंग और अच्छे ट्रीटमेंट की फैसिलिटीज मिलती है। सिटीज यूजुअली हैव लार्ज गवर्नमेंट हॉस्पिटल वेयर ऑल काइंड्स ऑफ इलनेस, चाहे वो माइनर हो चाहे वो मेजर हो, उसको ट्रीट करा जाता है। एंड जो पब्लिक हेल्थ सर्विस होती है थोड़ी चीप होती है, बट दे सफर फ्रॉम शॉर्टेज ऑफ मेडिसिन। यहाँ पे आपको मेडिकल इक्विपमेंट में नहीं मिलेंगे, बहुत बार मेडिसिन नहीं मिलती है, सो हॉस्पिटल बेड्स अवेलेबल नहीं होते, क्वालिफाइड डॉक्टर नहीं होते, ट्रेन्ड हेल्थ वर्कर्स नहीं होते, पेशेंट्स नहीं होते, और ऑफ्टन क्या होता है कि पेशेंट्स कंप्लेन भी करते हैं उनके बारे में। Now, besides public health service, various private health services are available. Many doctors run their own clinic, and there are also many privately run hospitals and nursing homes, जहाँ पे आपको अच्छा ट्रीटमेंट मिल सकता है, but they are mostly found in cities, and besides they are run to earn profit and therefore very costly. Increase profit, the doctor at private health center ये often prescribe करते हैं more tests and medicines. India has large number of doctors and health centers. Some of our the hospitals have facilities that are among the best in the world. Many people visit India as a medical tourist to get treatment in India. Often what happens, the people cannot get timely medical help and they have to travel long. What they do, they travel long distances to reach a health centers, and many cannot bear the cost of medicines and medical service. So what happened, private health facilities, urban areas have large number of doctors जो अपने private clinics चलाते हैं, and there are hospital and nursing home that are privately owned, and there are many laboratories that do test and offer special facilities, जैसे एक्सरे देते हैं, अल्ट्रासाउंड की फैसिलिटीज देते हैं, and we can say private health facilities, they are not owned for controlled by the government. In private facilities patients को क्या करना होता है, lots of money pay करना होता है, right? Now only a rich can afford them, but they give all facilities. खाली जो rich लोग हैं भाई वो उसको afford कर सकते हैं. Registered medical practitioner, they can treat only common illness, and often the villagers have to go to cities for special services. Now healthcare and equality. In India, private health services are increasing, but public services are not. So these private services, they are available in urban area. As the services are run for profit, जो cost of services है या तो वो ज़्यादा high होती है या बहुत मुश्किल से मिल पाती है. They both urban and rural people, they prefer to pay and seek the high quality services provided by private doctors. There are many reasons for such better medical attention and cleaner environment. Even those who are poor, they go to private clinics and hospital in the hope of better treatment and faster recovery. So what happened? Often they have to borrow money or even sell belongings to bear medical expenses. Some private health service providers, they prescribe unnecessary tests, medicines and injection or saline glucose. Most of the time what happens, the problems gets complex as poor people usually suffer from hunger, malnutrition, और वहाँ पे lack of proper food होता है. They tend to fall sick repeatedly. Poor sanitation facilities, pollution or unsafe water for make user situation worse. Educate healthcare is not available. No responsibility. No doubt, responsibility of the government to provide quality healthcare service to all its citizens, especially the poor and the disadvantaged. So health is as much dependent on basic amenities, balanced diet, clean drinking water, and we can say that clean environment and good economic condition of the people as its own healthcare service. Now basic amenities will help to prevent illness and disease, so the government must work on both prevention and cure to improve the health condition of all the citizens. So what in 1996 government of Kerala state in India gave 40% of the entire state budget to the panchayat, जो आपको basic amenities provide करेगी, right? These effort is going and storage of doctors, shortage of doctors, medicines, hospital नहीं है, लोगों को अच्छे से treatment नहीं मिलता. So government of Costa Rica in South America decided not to have an army. So it spent the money which was earlier used on army on the health or education of the people, which are the basic needs. So we can say that nutrition, safe drinking water, sanitary housing, Costa Rica is now considered to be one of the healthiest country in the South America. Right? This is all about in this chapter. Hope you understood each and everything. Now we'll meet in next class. Thank you.